Hello, my friends. It's me, it's Liz. Isn't this the most appropriate filter? Number one, because I don't want to wear makeup, and number two, it's got the cutest little mask ever. So I just wanted to give you guys a little bit of help on the blood traces. They are hard to get when we are together in lab, but trying to do it on your own without in-person help is a whole different story. So I thought I would help you by going through all of the traces together with you. So I hope this helps. If not, please let me know again, because clearly I have nothing better to do than find dumb filters to record myself. So all of our blood traces are going to start in the left atrium. And so this is the left side of our heart. So here's our left atrium right here. It's receiving oxygenated blood from the pulmonary veins. There's 4 of them, remember. Once the atria both contract, we're going to pass through this valve right here. And that valve is the left atrioventricular valve, the bicuspid or the mitral valve. So the first line on trace 1 says left atrium. The second line, you're going to put left atrioventricular valve and get in the habit of spelling out atrioventricular so that the automatic testing doesn't mark it wrong. So then we are in the left ventricle, and we know this is the left ventricle because of the thick muscular wall. Then the ventricles are going to contract, and we're going to go through this little vessel valve right here. And this valve is the aortic semilunar valve because we know that it's going to lead the way into the aorta. So once we are through the aortic semilunar valve, we will be in the aorta. And on trace 1, aorta is already given to you. So for these traces, you don't need to say ascending aorta, aortic arch, descending aorta. You just want to say aorta. That's the only line that we have for that. And on trace 1, you don't even need to worry about it because it already says aorta. So we are going to go to the medial side left wrist. So let me flip over to this picture right here. So we're going to go to the left side. So this is right, this is left. So if you remember, the right side here is the brachiocephalic trunk, and then we have the left common carotid artery and the left subclavian artery. So if we are going to go to the left arm, we need to take from the aorta the left subclavian artery. And then the subclavian leads into the axillary artery. And then the axillary artery leads into the brachial artery. And we need to go to the left side wrist. And just, again, remember to say left subclavian artery, left axillary artery, left brachial artery. And then we're going to end up in the left ulnar artery because we're on the medial side of the wrist. Oopsie. So once we've gotten to the left ulnar artery, we're at our destination point. So all you need to write, and it's already written in for you on table or trace 1, is the capillary bed on the medial side of the left wrist. And that's written in for you on that trace. So we want you to take the superficial veins back. And unfortunately, I couldn't find a very clear picture that had both the veins and the arteries on one picture. So I'm just going to go over to this picture right here. And this is where we left off. And so we're going to take this superficial vessel back. And this one is on the basement side of the arm. So if the arm were up straight off to the side, then this vein would be facing the floor and this vein would be facing the ceiling. So we're on the bottom side, so we're going to take this basilic vein back. So we're going to take the left basilic vein back. And we know that the left basilic vein is then going to dump into the left axillary vein. It's already given in your trace. And then we are in the left subclavian vein. And the left subclavian vein is going to dump into this vein right here, which is the left brachiocephalic vein. And then the left brachiocephalic vein will then dump into the superior vena cava. And at that point, then we're back into the heart. So the superior vena cava is going to empty into the right atrium. Once we pass through the right atrium, we've got to pass through this valve first, which is the right atrioventricular valve, or the tricuspid valve. And at that point, we're in the right ventricle. The ventricles are going to contract and the blood will pass through this valve right here, which is the pulmonary semilunar valve. And once we pass through that valve, we're in the pulmonary trunk, and then we're going to pass through the left and right pulmonary arteries. And at that point, we're in the capillary beds of the lungs. So you don't need to say like pulmonary venules, then capillary bed. You just say capillary bed of the lungs. And it's given to you on the trace, and it says pulmonary capillary bed. So then the blood circulates through the lungs, it becomes oxygenated again, and we end up back in the left and the right pulmonary arteries. You could just say pulmonary arteries. And then we're back into the left atrium. Okay, so trace number 2, it says from the heart to the liver, delivering oxygenated blood to the liver, back to the heart, then to the lungs, and back to the heart. So we don't need to worry at this point about the hepatic portal system. That is going to come on another trace. This one is literally just taking blood to the heart, blood to the liver, so that the liver can do its job, and then it's going to send the liver's deoxygenated blood back into the system. So just very quickly going through the heart again. So we are in the left atrium, pass through the left atrioventricular valve into the left ventricle. Then we pass through the aortic semilunar valve, and then we're in the aorta. And so then from the aorta, we need to take the arteries that are going to get us to the liver. So the arteries that are going to get us to the liver is part of the celiac trunk right here. So you would say aorta, then you would say celiac trunk, and then you would take the common hepatic artery to the liver. So this common hepatic artery is right here. So then you would need to say hepatic artery proper, and then the right and the left hepatic arteries. So again, from the celiac trunk, we went aorta, celiac trunk, common hepatic artery proper, and then the right and the left hepatic arteries. And at that point, you just would be in the capillary bed of the liver that we had already talked about. Again, you just say capillary bed of the liver, or liver sinusoids, it's the same thing. So in order to come back, we're just going to take these hepatic veins. So only the blood that is coming from the gut needs to go through that hepatic portal system. So just blood coming to and from the liver goes into these hepatic veins. And then we empty into the inferior vena cava, and then you're back in the heart in the right atrium. So from the right atrium, right atrioventricular valve, right ventricle, pulmonary semilunar valve, pulmonary trunk, right and left pulmonary arteries, and then you would say the pulmonary capillary beds. And then you return via the pulmonary veins, or the right and the left pulmonary veins, and then you're back in the left atrium. Okay, let's do trace 3. So from the heart to the anterior side of the right ankle and back to the heart, use the superficial route in leg on return to heart, and then to lungs and back to heart. So really quick through the heart, we've got the left atrium, the left atrioventricular valve, the left ventricle, the aortic semilunar valve, and then the aorta. So we're in the aorta now, and we need to decide which one of these arteries we're going to take. So we're going down into the right leg, so we got to go down the right side. So we're going to take this artery here, which is the right common iliac artery, and that feeds into this artery that's going to head down into the leg. We don't want to take this one because this one's going to feed the pelvis and the perineum. So we want to take this artery right here, which is the right external iliac artery. And it's going to pass underneath the inguinal ligament through the inguinal canal into the right femoral artery. And from that point, we're in this right femoral artery. The femoral artery, if you remember, it passes through that adductor hiatus to the back part of the thigh and the knee, and it's called the popliteal artery. And so then we have to decide which of these 3 branches we're going to take. So if you were to look in your white sheets under the arteries, find it quickly, right here, you would see that we have the option of 3 arteries: the anterior tibial, the posterior tibial, or the fibular. And so on our trace, it just said, if I'm correct, it just said the anterior side of the right ankle. So we need to use the artery that supplies the anterior compartment of the leg. So that would be the anterior tibial artery. So once we've gone there, we would just say capillary bed of the ankle, or capillary bed on the anterior side of the ankle, whatever. So then we need to decide which vein we're going to take back, and we're going to take a superficial vein back. So we have the choice between the great saphenous vein and the small saphenous vein. And we know that the small saphenous vein drains the lateral aspect and the posterior aspect of the leg into the popliteal vein, and we know that the great saphenous drains the superficial medial side of the lower leg. So we're on the superficial side, and so we're going to take the great saphenous vein back. And so we're going to take this great saphenous vein back, heads all the way up the leg, and it dumps into the femoral artery vein. And so we would say right great saphenous vein, right femoral vein, and then we're going to pass it underneath the inguinal ligament, and we'll be in the external iliac vein. And in that external iliac vein, we just go in the opposite direction again. So we should have marked my pages. There's our hepatic system. From that point on, we're going to be in, did I say right external iliac vein, right common iliac vein? And that point we're in the inferior vena cava. And then the inferior vena cava, we know it's going to dump directly into the right atrium. And then quickly through the heart, we have the right atrioventricular valve, the right ventricle, the pulmonary semilunar valve, the pulmonary trunk, the right and left pulmonary arteries, the pulmonary capillary bed, and pulmonary veins, and then we're back in the left atrium. So trace number 4 seems to be one that tricks people, but it's not too bad once you get the hang of it. From the heart to the distal part of the large intestine, or the sigmoid colon, so that's going to be the very tail end of the large intestine, and back to the heart, then to the lungs, and back to the heart. So left atrium, then we go through the left atrioventricular valve, the left ventricle, the aortic semilunar valve, and then into the aorta. And that should be becoming very redundant and stuck in your brain by now. And so from the aorta, we need to decide which of our blood vessels is going to supply the distal part of the large intestine. So I'm going to go to page 172 in my white sheets, and I see that I could take the celiac trunk, I could take the superior mesenteric artery or the inferior mesenteric artery. I'm clearly not going to the kidneys or the gonads. So I'm going to the distal part of the large intestine. So we know that the superior mesenteric does the proximal part of the large intestine. So the celiac trunk's going to be going over to the stomach and to the spleen and to the liver. So my last option is the inferior mesenteric artery because it's going to supply the rest of the large intestine. So my inferior mesenteric artery, if you remember, is this one right here. So I would say aorta and then inferior mesenteric artery. There's not a right or a left one on there. So from the inferior mesenteric artery, I would just say capillary bed of the sigmoid colon. There's a lot of arteries in between that you would run into, but we're not going to worry about those arteries. We're just going to say the inferior mesenteric artery is just going to go right to the sigmoid colon, and so we can just say capillary bed of the sigmoid colon. So then we have to take the hepatic portal system back, because if you remember, everything that goes through the gut, all of the blood that goes through the gut needs to have its little pit stop in the liver and be processed before it can go into the inferior vena cava. So we're going to take the hepatic portal system back. So there's my inferior mesenteric artery, and you can see this is this sigmoid colon right here, this whole thing right here. It's the sigmoid colon. So inferior mesenteric artery, capillary bed of the sigmoid colon. And then we know, according to our white sheets, find that page again, that the sigmoid colon is going to be drained by the the inferior mesenteric vein. I can't find that page. I don't know where it went. But anyway, the sigmoid colon you see here is drained by the inferior mesenteric vein. So you would just say inferior mesenteric vein. And then the inferior mesenteric vein, if you remember, it has that little detour right here where it's got to intersect with the splenic vein. So you would say inferior mesenteric vein, splenic vein, and then the splenic vein is going to dump into this big vein right here, which is the hepatic portal vein. So then the hepatic portal vein is going to send it into smaller and smaller tributaries into the sinusoids or the capillary beds of the liver. So the next line would just say capillary bed of the liver, or you could say sinusoids. It's the same thing. And then from there, the blood has been processed and the toxins have been filtered and bacteria has been taken care of and nutrients have been put into a form that we can use. And so that blood is going to enter into the right and the left hepatic veins into the inferior vena cava. So going again from, let's start over again from the aorta. So the aorta, we will take the inferior mesenteric artery to the capillary bed of the sigmoid colon, into the inferior mesenteric vein, into the splenic vein, into the hepatic portal vein, into the capillary bed of the liver, and then into the right and the left hepatic veins, and then into the inferior vena cava. And at that point, we would say right atrium, right atrioventricular valve, right ventricle, pulmonary semilunar valve, the pulmonary trunk, right and left pulmonary capillaries, pulmonary capillary bed, and then the right and left pulmonary veins, and then we're back in the atrium, left atrium. So say, and I don't want this to confuse you, but to say that there was a trace that was taking you to the, say, the ascending colon, you would take the superficial, why do I call it that? Superior mesenteric artery into the capillary bed of the ascending colon, and then you would take the superficial mesenteric vein, and the superficial mesenteric vein dumps right into the hepatic portal vein. So it would just say superior mesenteric vein, hepatic portal vein, hepatic, the sinusoids or the capillary bed in the liver, and then the right and the left hepatic veins into the inferior vena cava. So since we are taking the inferior mesenteric vein back, we have to say splenic vein before we get into the hepatic portal vein. Okay, trace 5. So from the heart to the right side of the frontal lobe of brain, then to lungs and back to heart. So starting with the left atrium, we have the left atrioventricular valve, the left ventricle, the aortic semilunar valve, and then the aorta. So then we need to decide which artery we're going to take to the head. So we're on the right side. So this is the aorta. So we need to take this vessel right here, which is the brachiocephalic trunk or the brachiocephalic artery. And that artery we need to take up here to the right common carotid artery. And that common carotid artery is either going to go external or internal. And we're going to be supplying blood to the brain. So we need to take the right internal carotid artery. So we learned when we did the vessels that the internal carotid arteries are going to be a part of that circle of Willis. So you don't need to say, like the basilar artery or anything, because we're not coming from the vertebral arteries. We're coming from the carotid arteries here. So you would just say internal carotid artery, right internal carotid artery, into the circle of Willis or the cerebral arterial circle. And then at that point, we'll just say capillaries of the frontal lobe. So coming back, we're going to take those sinuses that we learned. So we're in the frontal lobe, and they're telling us that we're going to take the superior sagittal sinus back. And we know that the superior sagittal sinus has a little area right here where it merges with the straight sinus, and that is called the confluence of sinuses. So the first line under the superior sagittal sinus will say confluence of sinuses. And at that point, technically you could either take the right or the left side back. That's kind of how your brain works. Your sinuses, the blood kind of sloshes around in all the different directions. So technically you could take either side back, but we're going to take the right side back. So we're going to say transverse sinus into the sigmoid sinus. So I would say confluence of sinuses, right transverse sinus into the sigmoid sinus, which then we know dumps into the internal jugular vein. So at that point we would say right internal jugular vein. And the internal jugular veins dump into the brachiocephalic veins. Because remember, the internal ones are a little bit more anterior. So they dump into the right brachiocephalic vein. So here's where we're at. Right brachiocephalic vein, and then into the superior vena cava. And then we're in the right atrium. So then right atrioventricular valve, right ventricle, pulmonary semilunar valve, pulmonary trunk, right and left pulmonary arteries, capillary beds in the lungs, right and left pulmonary veins in the left atrium. Okay, so not as bad as it seems. You just need to know the pathway to get to the frontal lobe and the pathway to get back from the frontal lobe, which is pretty easy. So, well, easy once you practice it just a little. Okay, finally, trace 6. From the heart to left testicle, then to lungs, and back to heart. So starting with the left atrium, somebody could probably make a song out of this now. Left atrioventricular valve, left ventricle, aortic semilunar valve, and then the aorta. So then from the aorta, we need to take the left testicular artery. So this was what we called the gonadal artery, but we know this is a male, so this is the left testicular artery. It would pass underneath the inguinal ligament and be a part of what's called the spermatic cord, and it would go to the testes. But you would just say left testicular artery into the left, or the capillary bed in the left testicle. So from there, we're going to take the left, this is a left testicular vein back. And clearly we're missing a lot of that left testicular vein. It would be coming from the testicle through the spermatic cord, underneath the inguinal ligament, up into the abdominal cavity, and that point would be in the left testicular vein. But we're just gonna say capillary bed in the testicle and then left testicular vein. And we know that on the left side, and left side only, the left testicular vein is going to dump into the left renal vein. So you would say left testicular vein, left renal vein, and then the inferior vena cava. And then you're in the right atrium, right atrioventricular valve, right ventricle, pulmonary semilunar valve, pulmonary trunk, pulmonary arteries, capillary beds in the lungs, and the right and left pulmonary veins. So just FYI, if you were taking anything to, like blood to the right testicle, instead, or from this right testicular artery, and this is the same in females. In females, the left ovarian vein is going to dump into the renal vein. But if you were taking anything on the right side, blood to the right side, you would take this right vein back directly into the inferior vena cava. So guys, I hope this helps. Please let me know how else I can help you. This is crazy times we live in, and I'm willing to do what it takes to get you guys through this class. So love ya. Talk to you later.